Hi, my name is Sydney Barnes. I'm a research assistant at Setting Scoliosis Straight, and I am managing the Altaline and Pasir studies. I have with me...
Hi, I'm Salil Upasani. I'm a pediatric orthopedic surgeon at Rady Children's Hospital in San Diego.
So Dr. Upasani, can you tell us a little bit about the abstract you did on how 3D analysis of the preoperative deformity in AIS can be used to guide surgical decision-making for selective thoracic fusion?
Sure. So first of all, selective thoracic fusion is one way to surgically treat children with adolescent idiopathic scoliosis. And in general, we prefer to instrument and fuse the thoracic spine, leaving the lumbar spine mobile for motion and activities that kids want to do. And especially as they get into adult age, you want to try to maintain flexibility and motion in the lumbar spine. So the point of this study was to see if we could use some of the newer technologies that we have to evaluate the three-dimensional deformity of the spine to figure out which patients are the best candidates for a selective thoracic fusion. And so basically what we were able to do is break down their spinal curve into 3D and find the characteristics of their spine shape that make them good candidates for a selective thoracic fusion.
And why did you choose to focus on this topic?
Yeah, so as our technologies continue to improve, we're trying to figure out the best surgical techniques and selection levels for these patients to give them a better long-term outcome. And recently we've published a lot of long-term outcomes after selective thoracic fusion, and I wanted to see if these 3D technologies that we're getting are giving us better information on how to approach them surgically as well.
Okay. And how do you think the results from your investigation might improve care for patients with scoliosis?
Yeah, so I think it gives surgeons a new tool to evaluate the three-dimensional shape of a child's deformity and plan surgeries that would help them maintain more motion segments and hopefully give them better function and better outcomes in the long term.
Oh, okay, cool. And this new year just started.
Yeah.
What are your expectations for this year? What are you excited about in scoliosis research moving forward for this year?
So we are in the second day of the Harm Study Group meeting. So today we're focusing on a lot of non-fusion treatment options for patients. And last year I was awarded a grant through the Scoliosis Research Society to study vertebral body tethering and kind of the biomechanical forces that go through the spine. And so I'm really excited that that project will come to fruition this year, and we'll be able to define the forces a little bit more objectively and then figure out what types of changes we're able to accomplish in kids' growing spines with the different amounts of forces that we're applying. So,
thank you so much.
Should be a fun year.
That's exciting. Thank you for taking the time out to let me interview you.
Yeah, no problem. You're welcome. Sure thing.